Hello, this is Dr. Lester Hartman from Westwood-Mansfield Pediatrics, and again, anything that's said here is meant for patients of Westwood-Mansfield Pediatrics, and your pediatrician may have a different opinion than we have. This is all in regards to allergies. We're into the spring here as of this video, and the fall is also the time when allergies begin as well. Today I want to discuss a little bit about allergies and some basic rules. One basic rule initially is number one, allergy medicines are best used in advance of your season. In other words, for example, birch pollens will begin mid-March, so March 1st is often the best time to start your allergy medicines. Once the inflammation and swelling has settled in, it's not quite as effective. So if you feel your allergies are severe enough, start your medicine on a daily basis to prevent the problems. Number two, develop a system to remind yourself, since allergies are often seasonal. Spring and fall, sometimes summer if you have grass allergies, for example. Here's a way that can be a reminder. The American Academy of Asthma, Allergy, and Immunology, on its website at www.aaai.org, again, www.i.org, has a place to sign up for pollen counts. Now here in the area, Salem is the closest, but what it'll do is every year, once they start doing the pollen counts, you will get an email, so you don't even have to think about this. It's strictly seamless. There's no commercial ads with it. You won't get any commercial ads. You'll just get the 4ai.org reminder, and it will tell you the type of pollens that are out. For example, oaks, which can be a green pollen, it can tell you in advance, when they've started to come out. But it's very important to develop a reminder system for yourself if you have chronic allergies in your children as well. Remember, almost all medicines are over the counter now. Your Zyrtec, which is citrazine, your Claritin, your Loratadine, and your now Allegra, fexofenadine, all over the counter and are basically 24-hour meds that are less drowsy. Not perfect, but a lot less drowsy than other medicines, such as Benadryl, which can be very effective, but also very sedating for some people as well. Remember also nasal sprays, which kids under the age of 5 will probably not like, but you can try the steroid nasal sprays. You need to come in to see us if you feel your child's allergies are severe enough, affecting their ability to sleep, constantly needing tissues, or rubbing their eyes. So you can do, you can manage most of your allergies without ever having come to the doctor. Now, there are people that come every year because they don't have a system in place to remind them, which we're happy to see you, but we might be able to prevent this with the way the costs are being shifted to parents nowadays as well. So there are three areas of symptoms. There's sneeziness, there's runny nose, and there's watery eyes. Now let's address what's called allergic conjunctivitis. Allergic conjunctivitis is common in the spring, and with particular pollens, and in the fall with particular things such as ragweed, which goes from mid-August till we get a few good days of frost on the ground. And people will rub into their eyes sometimes when they touch a surface outside the pollens. So it's important for us to realize that, for example, when an oak pollen starts and you know it, that it's in the air, start your drops. They're over the counter now. Zaditor, Z-A-D-I-T-O-R, which is ketoprofen, is the eye drops to use for your eyes, and you start those preventatively because your eyes, some kids' eyes will get swollen shut. Obviously, children under 6 oftentimes fight drops, so sometimes you have to just use the oral antihistamines. Now, how you put drops in is, the best way to do it is have your child, watch this please, I'm going to get up on the table, lie down like this. Have them look straight up at the ceiling, close their eyes, and then put 2 drops on each side of the eye, 1 to 2 drops, and tell them to open their eyes. That's a lot easier than trying to fight your child, trying to open their eye to put it in. So therefore, that's one area you can do for allergic, we call allergic conjunctivitis, not infectious, okay? Spring is much more common. The thing is, sometimes the pollen counts are so bad and the kids are rubbing their eyes so much, the antihistamines get overwhelmed, the drops, the oral antihistamines. One of the things to do is have wipes in your child's pocket, so when they want to itch their eyes, they can wipe their hands first, because it's really kind of unreasonable to expect people not to touch their face. All of us touch our face hundreds of times a day. Secondly, nasal allergies. Sometimes nasal allergies, you'll get a runny nose or a stuffy nose. The antihistamines work great with a runny nose and can be preventative in stuffiness if you start them out in advance. Sometimes people will use decongestants. Long term, you don't want to do that because it can raise your blood pressure and things like that. The other thing that's becoming in vogue now is neti pots with the saltwater solutions in them. Those are excellent to wash out your nose as well and maybe make your child feel comfortable. They might even prevent your allergies from going into a sinus infection as well. And prevention is the key here. Reducing days lost at school for your children, days lost to sleep, and days lost to work for parents as well. And nasal allergies are called allergic rhinitis, R-H-I-N-I-T-I-S. So those are the things that you can do for your kids' allergies and for your own allergies. And remember, most pollens, the pollens begin in March and end at the end of June. Then the ragweed starts mid-August and will continue till the first frost. Some people will have nasal allergies with dust and dust mites in cats and dogs, and when we shut up the windows and turn the heat on, if you have forced hot air, those will really exacerbate some kids' allergies as well. Also, we do have the ability now with a finger stick with blood to help determine what your child's allergic to, and happy to have you come in if you'd like to do that. It's not a perfect test. If things are positive, it's helpful. If they're negative, it may still be possible that your child is allergic. But this is an excellent opportunity if you wish you want to use that for now. This is Dr. Lester Hartman from Westwood-Mansfield Pediatrics, proactive in your child's care, caring for families for over 50 years rather. Thank you very much and have a good day.